The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Hi, everybody, and welcome to Humanity First. As promised, this is our second week looking at the issue of housing, insecure, housed and homeless individuals and families. We had a great conversation last week around the state of play with housing in America with John Yazwinski, and he's coming back again today just to sort of continue that conversation. I think what was fascinating about it was looking at the social structure of homelessness, the social structure of insecure housing, and how it's very predictable in terms of transgenerational wealth. That issue that we spoke about, that the best way to create transgenerational wealth in families is home ownership, and how that is denied to so many people, both racially and also through socioeconomic injustices. So this week we're going to be talking about what's to be done. What are some of the best practices? And having been around this kind of work for a long time, there are some interventions like Housing First that really do speak to a proper solution to homelessness. And as we talk to John, of course, people always say that a coalition to end homelessness is not about building shelters. It's actually building equity across any system in order for people to to everybody to have the benefit of housing. So it's going to be interesting as we talk about that. But I thought I'd share a story that from the news recently, and I'm sort of hoping to do this as we go forward. Some of the more odd stories that we pick up on the wire, and this one comes from Britain, and it was a story I read about a few days ago that a parachute, a woman was jumping out of a parachute, and there's a moral to this story that I'll get to in a minute, in England, and her parachute didn't deploy, and she was panicking, and she deployed her second parachute, which also didn't work. Amazingly, this particular individual, her name was Joan Murray, and you should look this up, survived. Her fall was broken by a tree, and she fell into a massive nest of ants, fire ants, I think they call them. And the fire ants bit her, and she had thousands of bites on her. And in fact, the reason that she survived was because she had so much adrenaline flowing through her body because she'd been bitten by so many ants, and she actually survived a fall from 30,000 feet. Extraordinary story. And I was thinking about this. What is the moral of that story? As far as I'm concerned, the moral of that story is, don't jump out of aeroplanes, and you won't get bitten by fire ants. We'll be right back. Thanks.
Hi, I'm Jamie. I'm an essential worker here at BAMSI, and I'm a nurse. Nurses are essential here at BAMSI because as nurses, we really have the opportunity to make an impact. We have very small ratios, so we have the opportunity to really learn everything about the person served and be able to give the best care. It really serves such a great purpose for me as being a nurse, and really why I came into nursing. Learn more about nursing opportunities at bamsijobs.org.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Welcome back to Humanity First, everybody. My name is Peter Evers, and as promised, for the second time in a couple of weeks, I'd like to welcome John Yazwinski. Hi, John. How are you doing?
Good, Peter. Glad to be back.
So last week we had a great conversation around some of the causes and some of the things that we're doing, both on a immediate emergency basis, but some of the more long-term planning for the issue of individuals who have insecure housing. This week I'd love to talk a little bit more about Father Bills in Mainspring and one of the probably your biggest capital campaign. I'm not sure. Maybe you've had a bigger one. I don't want to.
It's big.
It's a big one, yeah, and something that's going to make a huge difference in the city of Brockton. So can we start with that? Can you?
Yeah.
Can I give you a platform to talk about it, because I know it's a passion of yours?
Absolutely. No, I appreciate it. So, Father Bill's in Mainspring, we've been, sad to say, having to shelter people for, up to 40 years now. And we really looked at, okay, how do we change the shelter response? How do we go from just managing homelessness to actually ending it one life at a time every day? So we're excited that we've been able to secure a new facility, a site over on Manley Street. It was part of the VA campus, the National Guard building there on Manley Street. We've been able to secure that site, and we're going to create a kind of a mini campus to respond to homelessness. And this new facilities, and it's a new service delivery model, will focus on preventing people from ever having to become homeless. It'll focus on diverting people. A lot of times people just need a little bit of help here and there. They don't need to come in and get a shelter bed. And then we'll also focus on, for a particular group of people, how do we treat the shelter like a medical emergency room, right? If you and I go to the emergency room, they'll assess us and say, do you need a Band-Aid or do you need intensive care? And you get assessed. And so we want to look at it as a progressive engagement model, where if somebody needs a short intervention, and we want to reduce that length of stay as quick as possible. We have a lot of people that come to us that just need maybe first, last security for move-in costs. Yeah. But if they're working a frontline job in the community, it may take them months to save up $3,000 or $4,000. But if we know they've got a good history here, they've got a good job, let's immediately end that homelessness for that person at that time, because it's more costly to keep them into the shelter system, keep them in the shelter. The last point of it also is to provide a housing resource center, is what it will be called, a resource center that just also focuses on that group of people that need a deep subsidy operating support that needs to go into our supportive housing. So we're also going to build at this site 30 new efficiency apartments that people will be able to go to, that are real chronic homeless group, that are episodically homeless, time after time, struggling greatly.
So if those folks, I'm just going back to last week when we talked about the conversation with Dr. O'Connell, when he said all of the people, when you meet people who are on the street, again, you do hear some of these stories like, well, people want to be homeless. I mean, it's an absurd thought, right? Yeah. There is something in that person's life, either through trauma history, current addiction, or untreated mental illness. Remembering that treatment works, once we can treat. And I always say this, but in terms of mental illness, we have better outcomes as a chronic disease than we have with diabetes. So that there is always a pathway to recovery, no matter who that person is or where they are. But in that situation, those people who are coming in from the streets, what's the length of time that you'll be thinking about them being in your housing model?
Yeah. So I think when I came to Father Bill's place in 1996, and then really started to look at the data in 99 and 2000, what we saw when we considered, like, okay, what was for that long-term stayer that was experiencing homelessness, a long stayer, the average was like 7 or 8 years. And that's that person you see outside on the streets or in and out of the shelters. The housing first model that we're big fans of and are starting to implement really breaks down the barriers for that group to say, we want to give you a key. It doesn't matter if you're sleeping outside tonight. We're going to give you a place to stay. Yeah. And what we've seen is that group can over 95% stay housed more than a year, 93% over 3 years. Our permanent housing, we don't want it to be like a 2-year program, right? What we'll see is people that really have struggled with housing in mainstream housing and have mental health or substance use issues specifically, that as they go into more of a harm reduction model of housing, a little bit more barrier free, right, they can absolutely be successful and remain that tendency, being a good neighbor. So we'll see them stay there maybe 4 or 5 years and then maybe move into more independent. But if they need longer time, it's good too, because it's good for the person, but it's also good for the taxpayer, because the longer they're in the supportive housing, they're not ricocheting in and out of emergency rooms, in and out of psych hospitals, in and out of detoxes and things, in and out of police cars.
Yeah, it's interesting. I read a report about that when I worked in emergency psych services at Kings County in Washington, Seattle. All of those services are overseen by the city, and it's one of the few places you can actually judge what the real cost of the ricocheting is.
Yep.
And it's $100,000 a year, oftentimes, for these folks who are using the ED. When I was at Boston Medical, we had somebody who was in there every day of the year, one year, and once, a few times, twice in a day. And so there is a hidden cost, and that cost is often spread out between hospitals who are absorbing it through free care and police departments that are overstretched, and et cetera, et cetera.
And there have been so much data now out there that have studied that it's like it's a home run. It works, and we know it saves money too. I mean, we've got insurance companies now, for us, Mass Health and Medicaid, that are paying us to house their people that are homeless, that we have shared people. That's amazing, right? We have hospitals, insurance companies wanting to pay for housing because it works and it's good for the taxpayer.
Which is also a sort of move towards value-based care, right? And in the healthcare system, we're moving away from paying people for encounters of care. Like if I break my arm, I go in and get it set, but the preventative work is making sure that I'm not a slip and fall risk and I don't fall in the first place. That kind of intervention is really being valued now, which now I don't think that's on a big scale, but I think we're moving towards that. We won't bend the cost curve of health unless we do more preventative stuff as they do in other countries. And of course it begins with housing as well, which is the beginning point of that. So in some ways, we're post-COVID now. I would imagine that the situation has been exacerbated by COVID. The numbers seem to be a lot higher when we're looking at the people who are actively using on the streets in Brockton. It's probably higher than it's been in a long time. Where's your optimism? Where's your optimism coming from?
Yeah, because I would agree with you. I think it's like we're in that post-COVID of the numbers of people experiencing homelessness now are up. And they're not just up here in the greater Brockton area. They're up across the state. Doesn't matter if it's urban, suburban, rural. It's up across the whole country. And maybe some of that is, you're right, a lot of people didn't get maybe care and support during COVID. Everything shut down. People did get access to treatment on demand and things like that. And when we've seen 40% increase of unsheltered homeless in our region, never seen that in our history. So you're right, we are seeing a little bit of an explosion here. My optimism comes because I also think that what we've learned in COVID is that we can't go back to just managing and warehousing people. And if we don't want to have people sleeping outside, it is about housing. And let's really focus on a housing agenda. I'm very excited. The governor just released her new housing bond bill, and it's over $4 billion. And everyone's like, ooh, that's a big price tag. And it's yeah, but if you start adding up what we could do with that over the next 5, 6, 7 years in the housing production for our poorest neighbors, it's a real cost savings to the community. So my optimism comes, I hope that everybody has seen that through COVID, we need good housing with supports policy.
Yeah. And, it's interesting because when you said that, I was just thinking the other day about Michelle Wu in Boston, and I'm sure you've read about it, this idea of a basic wage or a payment to families. And I'm always interested that it's met with a lot of scorn, this is going to cost too much. You're giving people money for nothing, that kind of stuff. But all of the work that we've done over a couple of long careers, mine longer than yours, I've just been around a long time, is that we know that many of these issues that cost our society an awful lot of money come from people's the fact that they were some of the privileges that were available to us were not available to them. And I think about racial inequalities, I think about socioeconomic inequalities, and it seems to make sense to me that I always think about families and people go, well, poor families can't budget. They're brilliant budgeters, aren't they? I mean, because they don't have anything and they make that something spread an awful long way. Now, that might be cutting their pills in half, right? It might be making decisions that you have one meal a day instead of two. Those are difficult decisions for human beings to make. the ability for us to make people feel more comfortable, to have a roof over their heads, and have some hope about their future, because people get work when they're housed, right?
That's right.
Because you're not showing up at work every day after sleeping in your car and falling asleep at work, and all of those things, they're all so connected, aren't they?
Yeah, it's really looking at a value of, okay, like Father Bill's, nobody should be homeless, as you said, Peter. We look at that as, you're right, can we give everybody a home? No matter what that might look like, it might look a little different. Give everybody the stability of the home, then they're going to be much more, excited about helping my kids today. The kids are going to do better in school. You're not going to have generational poverty, maybe, where the kids were experienced homelessness their whole life as children, now as adults. There's so many things of investing and giving that basic right of housing. And I think you're right. If people can have a basic income to know, this is what I can afford to rent, this is what I can afford for food, because you're right, they balancing those priorities every week, every month.
Yeah, and this doesn't start 50 years ago, right? It's really interesting. I'm going to plug an Anderson Cooper book here, but I read a book called The Astors recently, and it looked at how the richest family in America became rich, and people will know, I guess, that the Astors were started with a German family who were beaver trappers, and they made their money in selling pelts. And what they did with that money was they bought up half of Manhattan, and they built tenements, and they leased to landlords for 20 years, and then the land would come back to them. Landlords would build really awful apartments that were so expensive that immigrant families would have to be stuffed into them and not pay any attention to the building because they were giving it back in 20 years. The Astors, in fact, created substandard housing for New York that lasted generations. And it just struck me as like, when you want to blame the individual, check yourself a little bit, right?
Yeah, there is some systemic failures here. And I even look at, even in our own communities here, back, in Quincy, they used to have the shipyard there, right? And back in the 40s and 50s and 60s, they built a lot of rooming houses. Well, who built those? The big employers built them for the workforce, because the workforce couldn't get here or couldn't live here. Now they employers can't find employees because the employees can't live in these communities around our area. We've got to make these investments of these simple, basic things like healthcare and housing, and it helps all people. Just like you got to be open to mixed income housing. One of the biggest concerns we have in the community is the not in my backyard. People just wanting to say, I don't want that type of housing in my community. We need to welcome all different levels of income.
Yeah, and when communities are saying that they're creating bylaws that says you can't build housing unless it's over 350,000, or what was it? It would be 1 million now, wouldn't it? But I remember that happened in Lakeville a few years ago. You're consigning people to poverty, and so you don't even have to look at them, and that's not humanity first, if you ask me.
No, the top issue with the housing world is in Massachusetts should look at is changing our zoning laws. We have to be open to more multifamily housing, and it can't just be 3 or 4 communities.
Right. And if you look at some of the places in Massachusetts that actually grew Massachusetts, and Somerville, where I used to live, more triple deckers there because of the old tanning factories.
That's right.
But they're still going, and they're still great, and there's still great housing stock.
It's a great housing stock for people.
Yeah. John, thank you so much. We could probably talk for another 4 hours, but I've really enjoyed that conversation. Thank you.
Really appreciate the opportunity. Thank you.
Thanks, everybody. Goodbye.